Yeah, this is Dr. Gregory Jenkins. We're back with the Doc and Doc show on AM 1220 KHTS. I'm here with Dr. Judith Curts, who just got back from leave 1 week away, and also with Dr. Pouchet, and she is the expert in thermiva here in this town. And she does all kinds of different, gynecological aesthetic procedures. And I know we were talking off air here just a moment ago about how much it cost. And I think people want to know, what does a 3-month treatment cost?
Absolutely, and that's a good question because it's important to think about finances as well. So when women come in and they're requesting rejuvenation just inside of the vagina, so this is more for the atrophic vaginitis, and they're not so worried about how it looks on the outside, then that would be a package of 3 treatments. Again, that's once every 30 days for 3 treatments, so it's 3 months, and that's $3,000. If they would like to have both the inside and outside done, again, 3 treatments, once every 30 days, that's $4,000. And then...
Excuse me, let me clarify. So the 3 treatments, $3,000 would mean $1,000 a treatment?
No, it's a package. So you pay your $3,000 and we'll see you 3 times.
Okay, right.
But actually, it's only $250 a week. And and Botox is $250 every time you go.
So,
Yeah.
I mean, really, and we're not going to say anything bad about Botox. I mean, get it if you want, but this really will make a difference in your life, I would think. So go ahead, tell us about the costs of...
Oh, for maintenance.
Yes.
And then the maintenance, it's once a year. So once a year, you'll come back for 1 session. And if it's just the inside, it's $1,200. And if it's the inside and outside, it's $1,500 for that single treatment.
And it just takes a few minutes.
It's 10 to 20 minutes depending on what you're having done. So you can come in on your lunch hour and
Could you bring your
go
lunch
back
and
to
have
work.
lunch while you're doing this?
I guess you could.
Bring your sandwich in and, kind of take your, not
Quick
be so
lunch break.
nervous. Yeah.
That's true.
Yeah.
It's funny, most ladies are quite nervous, but once they get in there and they become familiar with our personalities and the conversation, they open up so much. And then the next thing we get is, I don't want to have to wait to come back. I love spending time with you guys. What else can I do?
Well, what else can they do? What else? You do a clitoral hood reduction?
I do. Often it's done in conjunction with the labia minoroplasty to give a sleek look from top to bottom. But I have had women come in that have either had labiaplasty elsewhere where their surgeon didn't know how to do a clitoral hood reduction, and they have the evidence as to why they often need to be done together because it looks like they have a little baby penis. They have too much skin up at the top. And so I'll perform it on them. And I've done it for women who notice that it just takes them a long time to achieve a clitoral orgasm, and it's because they have excess amounts of skin covering it. So then they'll come in, they'll have their procedure, and again, very, very, very happy with their results.
So it's interesting that you do revisions from other physicians. What's the training for you to do this? I mean, and I'm a real buyer beware, go to the best for whatever, go to somebody that knows what they're doing, not somebody that says, I can do that.
I can't agree with you more. It's so important. I've seen so many patients who have had their procedures done with other physicians that just throw it on their menu. They may be a plastic surgeon, they may be a gynecologist who's like, I can do that. Little do they know, there's a lot more to it than just cutting it off. And so they come to me with botched surgeries where on one side they have a hole in their labia and the other side's left open, and I take time and care with them to do their revisions. And the training is important. 1, having done many, many of these. 2, having been a gynecologist who was very sensitive to women's needs because I've had many children. When I would repair their episiotomies or I would repair any tears they had during childbirth, I paid attention. I used a cosmetic eye to make sure that it looked back to normal when they were done and not just stop the bleeding. So that's where the passion started. Then, because I knew I wanted to focus in on this area, I went ahead and did a preceptorship, and I trained with one of the revolutionary doctors in doing this procedure, Dr. Red Allensod, down in Newport Beach. I did a preceptorship with him, made sure that I learned some more plastic surgery techniques because you want it to look good, because that's why patients are coming. And then, I just honed my skills, and now, like I said, I'm one of the leading experts.
And we have really wanted you to be on the show for a long time. I think even when we started it and started talking about guests, so we're just so delighted to have you. And please take advantage of this and give Dr. Pouchet a call, or you can call her at her office. What's your office phone number so that they could call you there?
Oh, absolutely. Our phone number is 661 312-0497, and you will be greeted by most likely Annie Avakian. She is our fantastic, I know she's a catch-all. She's our patient coordinator. She will hold your hand through the entire process, answer all of your questions, ship you out medications if you need it. We have a lot of international clients as well, and clients that come from out of town, and she helps to coordinate their travel. She really does it all to make sure you're completely comfortable with your experience.
And she's here and does not want us to ask her anything, but she's a lovely, lovely lady. But we're not going to ask you anything, Annie, okay? You don't have to come to the microphone. She's laughing. She's adorable. So anyway, so, you know, I think it's strange that women seldom talk about how they feel about their genitals.
It's so
yet
true.
they suffer with that.
They do, and I think what's changed and why it's become a much more popular surgery and women are coming out of their shell and being able to ask about it is twofold. One, how popular the Brazilian wax is. Now it's not hidden. Everybody can see it, who you're showing it to at least. And so, you know, it's more prominent, and that puts a little bit more anxiety on them to go and have something done. And then second is just how sexuality in general has seemed to evolved in our culture, and how so many things that were shameful in the past are not anymore. I mean, for me to hear someone or have a patient talk to me about any toys that they're using or pornography or whatnot is, I mean, I don't even flinch at it, and I don't think anybody
vanilla,
does.
isn't it? You know,
yeah, it's not a big deal.
Yeah.
So we're not such a vanilla society anymore, and
we're
for the benefit of women who have been suffering with because some women do come in purely for cosmetic. They just want it to look prettier. But most of my women are coming in for a functional reason. And on that end, I'm hoping at some point insurance will cover it for that reason as well.
I just think the Thermiva sounds like an amazing thing that they're doing. And is that a brand name, or has it been called something else before?
It's not. It's not been called something else before. Thermiva is specific to the radio frequency technology, whereas some of the others like Mona Lisa and FemiLift are using a different technology called a CO2 laser in general. But again, their application is only internal, and I don't believe they have all the FDA approval that Thermiva has.
I know for plastic surgery they have, similar techniques where they put this thing on your face and makes it intense light, and it tightens the tissue up underneath, which makes the tissue on top better. So I imagine it's similar to that.
Very. In fact, that company, Thermi, has Thermi-Tight and a variety of different Thermi products to tighten your skin and tighten other areas of the body. But because I am a specialist in the vagina, I only use them.
Only need that.
Yes.
I think it's interesting culturally that all through time, men have always thought about how much bigger they could be. And you're showing them how much smaller they should be.
Well, I'm showing them that women can tighten up their area to accommodate whatever size they are.
The labiaplasty, if you don't like it, fix it.
Yes.
That's what I think. So it's interesting culturally. Men and women are so different. Men want the big things. Women want the nice-looking things, basically.
Right. And small, yes,
small, right.
in general.
Yeah.
I mean, we really don't hear about men saying, "Oh, I really don't like the way my penis looks." I mean, they want it bigger, but they don't.
But they're not going to go and have surgery for it.
No, they're not going to touch that. No way. But women will have surgery for things like that.
But for women, it's very functional. I mean, without it, they aren't getting the pleasure that they want. They are not able to feel the friction as well. So for a man, it's more psychological. You feel powerful with a bigger penis.
We're hunters, yeah.
Right?
Yeah.
But for a woman, it's kind of like, wait, I used to be able to feel when my partner was inside of me, and now I'm not really getting anything.
Right. Well, and that's primarily after childbirth, isn't it? Or not? What
And
are the
age.
reasons?
Correct. So
And age.
childbirth and aging. childbirth being the number one factor that would increase the size of the vaginal canal. So yeah, that's the key. And so that's why they come in wanting to have it tightened up, as well as wanting to be able to have more orgasms. So anything that brings that sensation back is a bonus.
What's the actual, in the studies, what is the actual percentage of reduction in size?
They didn't show a size reduction. Because it's hard to measure because it's a flexible tube.
Right.
So what they did was they looked at patient satisfaction, and the patients were highly satisfied, and it was 95% of patients noticed a difference in the tightness of their vagina.
Well, they do that like with like blood pressure medicines. They've done studies not so which medicine works the best, because they all work. Which one has the least side effects is what people want. So like you have the least side effects and get the best results. So everybody should go for Thermiva.
Absolutely, it's the way to go.
You know, I've heard of, and here, I'm back to pain again. You know, I'm such a chicken. I want to know, so many women have had, I think it's Cool Sculpt, and where you get rid of the fat around your waist or stomach, and they say it doesn't hurt, and they talk, it doesn't hurt, but then later they have cramping and they experience. How is this different?
Completely different. So
Good.
Typically when I saw Cool Sculpting, and we actually looked into it from my office, and it says either virtually painless, or they use these little qualifiers.
It feels like a rubber band snapping against your skin thousands of times.
Really
thousands
hurt.
of times.
No. Yeah. But that for Cool Sculpt, they actually, the procedure itself, from everybody I've talked to, hurts. They suck your skin into something, and it does hurt a little. I mean, but often doctors like to, it's only going to pinch. It's going to be a little bit. With Thermiva, that is not the case. It does not hurt at all. There's no qualifier. It is pain-free.
I have a feeling when you get to your office, next time you go in, people are going to be lined up, waiting to come in, or the phones are going to be quite busy, because I just think this is an amazing, amazing treatment and it's something for women. Finally, we're getting something.
It's fantastic. And the other group of women that it truly benefits are women that have had babies, because when you give birth, be it via C-section or a vaginal birth, what tends to happen is your bladder suffers from that trauma and you get leaking. And so not only does it tighten your vagina back up from having a baby come through it, but it fixes the leaking. So you can go to the trampoline park with your kids, go to Sky High, jump away. And you don't have to wear a pad or anything to catch any of the urine that's leaking.
So this is so different. We hear about, some plastic surgeons talk about a mommy makeover, and I've heard that a lot, the mommy makeover, but it really doesn't take care of what has happened to the body.
It doesn't take care of everything. So we think of it as this is the mommy makeover extreme. Like let's do all of it. And in fact, I've done a few combination surgeries with Dr. Justin Heller here in town from Heller Plastic Surgery, where he'll take care of the breast and tummy tuck, and I will take care of the vaginoplasty and labiaplasty or perineoplasty if needed. And they get the full, complete mommy makeover, where now mommy is back to her pre-mommy status with her body.
Wow, that's amazing.
And if mommy ain't happy, nobody's happy, right?
That's absolutely correct.
Right. It's on, I saw your advertisement, and it says, if mom's not happy, no one's happy, and invest in your happiness and theirs. I love that. I love that. I mean, there's no shame. It shows a mom on there. I just love your advertisement.
Absolutely. It's important for women to know that all the changes that your body goes through from childbirth, that you don't have to suffer through them. I mean, yes, it's a part of nature. It happens to everyone, but now we have treatment for it, Why
Right.
not?
I think it's
So
good.
how about for an atrophic vagina? Does the Thermiva work great for that?
That is what it was developed for, so it
And-
works best for that.
And how about a grandma postmenopausal?
Absolutely.
Still works.
Works beautifully. We have some patients that are 70 years old getting back into the dating arena, and they're a little nervous about putting it back into action, so they come to us first. We rejuvenate it. We get it. They cannot believe the results, the moisture that they have, and the fact that they don't bleed with intercourse.
Wow, that's fantastic.
So back to dating at age 70, and then you're feeling like you're a kid again? Ooh.
Oh, dating, I've learned so much from this population about what's out there for when you are a little bit older. Things like where you get to go on cruises, singles cruises for over a certain age and meet a whole bunch of people and travel the world. And it sounds fantastic, but they need to make sure that they're ready to go for it.
Instead of being, oh, I'm too old for this. And I've had some of my patients say, oh, well, that's done. After menopause, we are done, no more. And that's not true.
It's not true. And then there's that other trend of women that like to date younger men. I've had many clients come in that are postmenopausal, and but their boyfriend is 30.
Dr. Dr. Curts knows about that kind of
I
stuff.
know all about that. Yes. Thanks. No, I think, whatever makes you happy, do it. If you don't hurt anybody else, you should be happy. And I would highly, highly recommend this to any women who are older and maybe afraid to get back into the dating arena, thinking I'm too old, or this is not going to work, or it's going to work. And of course, I always talk about with libido, if you want to get back into it, self-pleasuring. Do you ever talk about that with your patients, or?
I do. With some of my patients, we need to talk about that depending on what their goals are with what I'm going to do for them surgically or with Thermiva. And definitely anything that builds your confidence. I mean, that's the key. I really believe for every person out there, if you feel confident, if you feel good before you go to engage in sex, then it's going to turn out better.
Then you're going to have wonderful sex.
Absolutely. And for each person, what that is different. Like for me, when I am in shape and I'm fit, everything is fantastic. I feel confident.
Right. Well, I mean, it sounds great, and I wish people would call in for questions, and I think they're probably going to call your office instead. Do you want to give that number one more time?
Absolutely.
For
We
your
totally
office.
understand because, like I said, it's a sensitive issue. Confidentiality. What if somebody recognizes my voice? I'm sure
Right.
is what they're thinking. So go ahead and give us a call at 661-312-0497.
And that's Dr. Courtney Pouchet. It looks like Pouchier, and I was saying that for a while, but she corrected me, and it's Dr. Pouchet. So, she is so easy to talk to, and we're asking her just all kinds of questions. What have we not asked you that I think you might want people to know?
I'm board certified. I think, like you said, it's always important to go with somebody who is qualified or more than qualified to do what they do. So I'm board certified. Been a doctor since 2001. I went to undergraduate at UC Davis.
Okay.
And then I did my medical school training. It's now known as Drexel University. When I was there, it was called MCP Hahnemann in Philadelphia. And then did my residency at UCLA and at Harbor UCLA. I used to work for Kaiser. When I was back delivering babies. I was a partner there, and I've been here with my practice in Santa Clarita since 2012.
Dr. Pouchet, you don't look old enough to have all of that training. I'm sorry, you just don't. She looks amazing.
Thank you. I get that a lot, but I am. I have 7 children. My oldest is 25. My youngest is 2 months old. Oh, almost 3 months old.
Well, that's a gaposis. Gaposis.
Most definitely.
So
I have all the ones in the middle to fill in that gap.
So you had a little self-disclosure. You said you've had Thermiva. You've had this treatment yourself.
I have, and it is fantastic. I didn't get to finish the treatment because I did get pregnant with the 2-month-old, but
You
I
got
did
pregnant
have
because it was so good.
It was
I guess
so
that's what
good.
happened.
You got it right.
So birth control is very important if you're having this treatment.
Most definitely.
Right. If you don't want to have children. So you are listening to AM 1220 KHTS, your hometown station, and we'll be right back with Dr. Pouchet. And we are back with Dr. Courtney Pouchet, who is a cosmetic gynecologist. We've been talking about so many new treatments and interesting things. And Dr. Pouchet, you also have Pelavi. Tell me how to pronounce that, because this is a brand new thing. And tell us, this also she is in Santa Clarita, so you don't have to get on the 5 and the 405 and all those numbers to get to her office. You just drive down Newhall Ranch Road, I believe, isn't it? And then Kelly Johnson is nearby. So tell us about Pelaviv.
Absolutely. And yeah, it's very nice that I'm right here in town. Many of my clients do come from Beverly Hills. They come from the Inland Empire. They come from all over. But for our locals, it's always nice that we're right down the street. We do also offer a procedure called Pelaviv. And although I do specialize in the vagina and I focus almost solely on that, it's so nice to be able to offer this to my clients, my patients, my friends, my family. Pelaviv is a treatment using radio frequency waves that can help reduce the number and the depth of your wrinkles that start to develop on the face.
So this is not painful.
color.
Pelaviv also?
It's not painful at all. It's similar technology. It uses radio frequency. It heats up the skin of your face, around your eyes, gets rid of the dark circles around the eyes, gets rid of some crow's feet, some laugh lines. It's very similar, so you need the 3 treatments 30 days apart, and then annual maintenance.
Oh, I want that too. I want it all. And I think we have, we're getting hooked up. Please forgive me. We have somebody calling in. Roger, and you're calling Dr. Pouchet, is that correct? Do you have a question?
Yes. My question is about these products they have for the lubrication during intercourse, and then the ones they have that are you might put on the clitoris area around there that are that stimulate more. You know, if the use of those things can cause any problems, or how often should you do that? Use it, not all the time, sometime, whatever. What's your opinion on that?
That's a good question. That can cause problems if there's sensitivity, and the vagina is a very sensitive area, as is the clitoris. And unfortunately, a lot of women do experience sensitivity to different types of lubricants, even to latex itself, like within a condom, or the spermicide in a condom, and sometimes women even have sensitivity to their partner's own saliva. So unfortunately, repeated use of various different lubricants can over time cause some issues for the woman.
Does that answer your question? I think it did. So I'm choking myself here on Dr. Pouchet gives a free consultation in her office. Parking is easy. You just go right there, go right into her office. So there's a lot of convenience. She's right here, and she's the best. I mean, what more could we ask for? So we're really excited about this. I want everything done. Okay, I'll be in your office, the head of the... We'll start with the face. Anyway, it's pretty exciting. And we just appreciate you being here so much and taking your time just to come and talk to us about all the new treatments for women. And I think it's extremely exciting.
Oh, it's fantastic, and it's my pleasure. Thank you so much for having me on the show. I love to get the word out. I love to make women more comfortable with seeking out the care that they need to be comfortable in all of their experiences, be it working out, be it in bed with their partner.
Exactly. I think information, knowledge is power. And when we know that and we know we can do something about it, I do that with psychotherapy, and you do that medically, and it's just, I think it's great news for women. I mean, Viagra has been a fabulous thing, and Cialis, but now we have something for the ladies, and I just think it's really exciting. And there's no ageism or anything. It's a great thing. So thank you for listening, and we will see you next week.
That's right. Next week we'll be right back, and next week we're going to have the comedian Flid back on the program again. So that's always a fun 1 hour. So make sure you make it back. And Dr. Pouchet, thanks for coming. I think it's so much information today, and the parking is easy. That you get to your office is easy. It's all secluded so that nobody can see if you're there. So I think those are all wonderful ideas. So I want to thank you all for listening to AM 1220 KHTS in downtown Newhall. Thank you very much.